It's a real pleasure to be here. And you know, I was struck, I want to reiterate something that Bill Blair said this morning, and that is that legalization is a process, not an event. And if you need any evidence of that, think that we are still building a legal framework for tobacco 60 or 70 years later. We started regulating tobacco meaningfully 60 or 70 years ago. There is Bill S5 right now, which is a further restriction on tobacco marketing. So, you know, I think that's worth bearing in mind. But what, of course, is different is that the government gets to specify a framework from the ground up, and it has the opportunity of building in some of those lessons that we've learned in the last 6 or 7 years. I do not take money from any industry funding. I do advise governments, and I have served as a paid expert witness in court cases. This is typically when tobacco companies or beverage companies sue governments over public health laws, and I defend the governments. And I have earned every one of my gray hairs doing that. Our historical approach has always equated any use of cannabis with problematic use. And it really hasn't left any space for us to talk about harm reduction. That's, of course, changed. And I think you could make a pretty strong argument that the Cannabis Act is inherently based on a harm reduction framework. And, you know, there are always people that are skeptical about the government's motives, but what a pain in the ass to take on, whether you're trying to score political points or not. But really, starting from the task force to reading the Act itself, and if you haven't, it's not that bad of a thing to read, it really is, in principle, based on public health. Now, the point is that, as someone else pointed out, legalization, it's not a binary thing. It's not like it is legal or not. The impact of legalization regulation depends on many different measures. And let me start by just saying something about the risk. Most cannabis consumers do not exhibit problematic use. That's a fact. We published something that said it's about 2% of monthly users that might have some problems. By any measure, it's less than legal substances like alcohol and tobacco. So the most recent estimate is somewhere around 290 deaths per year, compared to thousands for alcohol, compared to tens of thousands for tobacco. Those are facts, they're not opinions. And that actually most of the mortality, for example, from cannabis comes from excess risk, from impaired driving and from some respiratory disease from smoking. And so the idea is that whatever problematic use is out there, actually we can probably minimize that. And the excess risk associated with how cannabis is used, people have talked about lower risk use recommendations. So Benedict Fisher and his group, this is come out of CAMH, it's being endorsed by the CPHA and other groups. And I've reorganized it a little bit. But if we want to minimize the risk of cannabis, and as everyone's pointed out, it's already happening. We aren't inventing cannabis with the Cannabis Act. So whether it was legal, whether it's illegal, if we want to minimize the excess risk, then you can think about a couple of things. We can think about the excess risk from who's using it. So the earlier it's used, the more intensely it's used at an earlier age, that's one of the best predictors of problematic use. So if we can delay onset, that's a good thing. If we can avoid pregnant women from using cannabis, especially if they're smoking it, that's a good thing. If we can minimize use among people that are susceptible to psychosis, and I've added this, but accidental ingestion, the acute effects from excess consumption, that's something, especially when it's done by kids. So obviously accidental consumption when it's around the house. You can also minimize risk by thinking about the types of products that are used. So most of what we know about cannabis, when I talk about problematic use, it's kind of the old school regular cannabis out there. And yes, the THC levels have gone up, but there's a whole other class of concentrates out there where it's not 20%, we're talking 60, 70, 80%. And we really don't know. There's reason to believe that problematic use of concentrates like that could be higher. So all other things being equal, the risk might be minimized by thinking about the cannabinoid level and THC, or the ratio. Synthetic cannabis use, which has excess risk. There's news stories about deaths due to contaminated samples. If we can get people to take their drugs without smoking it. There's a reason why we don't prescribe things for people to smoke. Smoke adds excess toxicity. Most of the risks of tobacco are from lighting something on fire. If I rolled up any organic material and smoked it, you'd see many of the same carcinogens. So if we can get people to take their drugs without inhaling smoke, all other things being equal, that is a good thing. And also we can think about the setting. So setting, I mean, that's not an ideal way of talking about it, but certainly there are, very intensive, excessive consumption, but especially when people are taking cannabis when they're driving or before they're driving, and also if they work in occupations that have some high risk. So this is kind of a summary of the different low-risk use guidelines that are out there. And I'd like to speak to how our regulatory framework can minimize some of those excess risks. And as I said before, legalization isn't a black or white thing. How it's regulated and how it's legalized will impact who's using it, how much they're using, what types of products. And it's not as if we can exert complete control of those things, but we know that some of those factors are very important. And so I've worked in tobacco control for 20 years, and these are some of the regulatory measures or domains that we talk about. So let's walk through a couple of those and think about how those might be used to minimize excess risk. This is our official type of communication so far, and this is not a good demonstration of how you communicate with people. Images, color has been invented that we can probably use. This is still based on a print layout, and Health Canada is the first to acknowledge that they're working on revising this. And you heard from Hannah that Colorado has done some innovative marketing, and because most of you are still awake, I'm going to play a commercial for you just to keep you awake for another couple minutes. And this is one of those campaigns in practice. Let's see if this works.
Here's a message from the state of Colorado to the state of Colorado. Now that marijuana is legal here, we've all got a few things to know. But instead of just telling you what you can't do, we're going to tell you what you can do too. Here we go. If you choose to use, don't drive high. Instead, just walk or skip or catch a ride. You can even frolic or stroll or run. Just remember, you gotta be 21. That's to have and to hold and to buy and to use. And if you do, public space, federal land, and your car aren't the place. Stay at home. Keep it locked and under a lid. And most importantly, keep it out of reach of the kids. For those underage, it's just not okay. Their brains are still growing, so keep it away. And remember, whatever you get here can't leave our state. So stick around a while. You'll find this place is pretty great. Visit goodtoknowcolorado.com for more info, because when it comes to marijuana, it's good to know.
So that does not look like the devil's lettuce ad. And it not once in there, I don't believe, did it say don't use the product. It talks about how to use the product and ways to minimize risk. And there's all sorts of different examples of that. There we go. But one of the important things, and there were a few specific messages, but we've just said don't use it, it's going to harm you if you use it. If we're going to communicate harm reduction messages, there needs to be some specificity to them. So this is a print version of that, but it says things like consumption, dosing. We did focus groups with youth and young adults, and kids are very curious. They want to know about the difference between edibles and smoking and what shatter and wax is and things like that. So there's lots of examples. In terms of driving, one of the important things that people should know is that there's different time lag in terms of the onset. So if you're a naive user and you take an edible and you sit around for half an hour and go, this isn't doing anything, and then I'm going to go out for a drive. People need to know that there might be implications for the dose and for the method of administration in terms of their level of impairment. And we probably need to talk a little bit about workplace safety. This is something that the folks that work in occupational health are talking about, and we probably need to do that in a dedicated way. Now, some of you will know that already, even though the Cannabis Act hasn't been passed yet, they're already sharing some of the regulations. And Health Canada has proposed some of the health warnings. And I think it's actually instructive, because if you look at these, and people have different thoughts, and I've certainly done media interviews where people think that they're, over the top. But look again, I'm going to walk through them right back now, but not one of these warnings actually says don't use. And if you look at the topics of each of those, that maps on pretty well to the low-risk guidelines, doesn't it? And so that's about what they're going to look like. That's a mock-up from the government. There's one, cannabis smoke is harmful. So I think that's trying to get at, don't use your drugs by smoking them. Don't use if you're pregnant or breastfeeding. The little text underneath can be swapped in. I'm not going to go through all those. Don't use cannabis in drive cars or use machinery. There's one on psychosis and schizophrenia that also references high THC content. one around early adolescent use, and this is clearly the hardest message to communicate. How do you communicate to kids that, you know what, we've been really not doing a good job for the last 80 years communicating with you. We're not just saying don't use it, but you have to believe us when we say that there is excess risk for using it heavily when you're young. There's one on addiction. And you know, one of the interesting things is the government had to make a decision about whether to use pictures or not in the warnings. You guys remember our tobacco, cigarette warnings had big ugly pictures on them. And the government chose not to do it. And what's interesting is if you look at the regulatory sort of document, it actually contrasts these warnings with those for smoking. And I think what the government was trying to do implicitly was say tobacco is much more harmful, and that's why I use those big ugly pictures, and it's not for cannabis. And it's an interesting example of some sort of tentative, sort of implicit messaging around relative risk across different substances. I always point out that pictures are just a good communication tool no matter what you're saying. This is from, I think it's the Madrid Transportation Authority, and they actually use pictures to depict the risks of man-spreading. That's no joke. So there are benefits to just using images as communication. There will be product labeling to try to prevent accidental ingestion among kids, which although, you know, as far as I know, there's no recorded deaths, it's certainly a concern for folks. Here are some examples from different states. That's Washington State in the middle. And here's what our government has proposed. So that every cannabis product sold is meant to have that label on there. And I was giving a talk a couple of weeks ago somewhere, and someone got up to the mic and pointed out that it looks a lot like the logo on the Canadian hockey jersey. I have 3 kids, and I showed them these 3 pictures, and I said, which one do you like? They liked the one on the right. I said, if these were on products, which one should you not use? And my 5-year-old daughter said, oh, the one in the middle, that says no, stop for kids. So I don't know why they designed a very nice, engaging logo that looks like branding to say, don't use this product. Right. We've heard marketing with the commercialization of cannabis. There's been a lot of debate about advertising and marketing regulations. You know, we have a much different approach to marketing restrictions than the US, both with tobacco and with our proposed cannabis. And really, I testified on this in the, I can't remember if it's a House or Senate hearings, but it's worth asking, okay, what role does advertising play in a market designed to promote public health? What benefit will advertising provide? We know from other domains that if one of the goals is to minimize use among kids, kids are actually most susceptible to advertising and marketing. And actually what the government said is, again, much different than most US states. It says no youth or lifestyle ads. What does that mean? It means no broadcast advertising. The only advertising that people should see are in adult only venues like inside bars or direct mail. So hopefully we should see very little. They've also said we're going to have plain packaging-ish. Some of you will know that this is coming for tobacco products where it's just this background. There's no branding at all. You get your name, you get your health warning, and you get this, some people call it fecal brown color. That's a universal color in the background. They didn't quite do that for cannabis. There's our little cannabis logo. What they said is you can have a company name or a brand, but it has to be no bigger than that cannabis logo. And you know what? You can use different colors for the background. Here it's white, but you can only use one color. Some sort of weird mix between limited branding. But again, I think they're trying to position relative to tobacco. The retail point of sale will be a very interesting environment. It'll be very interesting to see how that plays out differently across provinces. And it will be fascinating. We assume, I think based on practice, but we assume that the privatized retail frameworks in some provinces that we'll see a lot more in-store advertising and branding. Well, we have provincial alcohol distribution and retail in Ontario, where I live. You know, they produce a beautiful magazine promoting, they have beautiful posters in the stores, they have this is online. You know, will we see the same thing for cannabis? Do we want to? Do we not? But it'll be interesting to see how the public government-run retailers over time may or may not engage in that sort of advertising. Now, one of the other areas to talk about is product standards. So should some products be allowed and should some not be allowed? You look in a lot of US states and you see this brilliant array of different products. I think this is a store in Colorado. You see what many people refer to as child-friendly products. I think that's fair to say when you're talking about lollipops. And you see a wonderful array of flavors. So I do a lot of work in vaping products, and my favorite flavor of all time is unicorn horn flavor. Now, I don't know what that tastes like, My daughter told me she wanted to be a unicorn when she grows up, but certainly we have good evidence that there are certain flavors that preferentially target kids and young people. And our government has at least indicated that they propose to restrict certain flavors. The regulations on edibles will be a year after the main legalization, so that's still yet to come. But they've indicated that they will be prohibiting products and flavors that will preferentially appeal to kids, and including mixed products like mixed cannabis and alcohol and things like that. So what should we tell people about modes of administration? You know, one of the biggest myths out there is that tobacco smoke is less harmful because it's herbal, because it's natural. And the tobacco companies put all those things in the cigarettes, and that's what makes them harmful. That's not the case. Like I said, it's a function of combustion. And the main difference in terms of respiratory damage is just that most smokers smoke 15, 16 cigarettes a day, so you're just getting more volume smoke. But pound for pound, cannabis smoke has just about the same amount of toxins as tobacco smoke. So what do we want to say? Do we want to try and push people away from smoking? How far down the road do we want to go in terms of communicating relative risk? So don't be shy, but I'd like to know how many people in this room think that vaping, like using an e-cigarette, is less harmful than smoking a conventional cigarette. How many people think that vaping is less harmful? Okay, the answer is it is. And it's taken us 7, 8, 9 bloody years of debate, but now our federal government, the US CDC, and all of those agencies now agree. Now, that's not to say that vaping is good and promotes public health, but there is a difference in risk when you're not inhaling smoke. And we know that people have been vaporizing tobacco. You know, vaporizers started from tobacco. Someone showed a picture of Volcano. And we were going to do a study a couple years ago on vaporizers, and I went to buy one of these things, and it's a big thing, and it has like Bob Marley colors and a huge balloon. I said, we can't use that in a research study. But many cannabis consumers vape, and they should probably know that it's less harmful for them to vape in terms of lung health than it is to smoke. But what about other product categories? This is from about 1,000 youth and young adults in Canada, and we asked people, how much do you harm yourself? And this is people saying great risk if you use it regularly. You can see vaping, some indication that they recognize it's less harmful than smoking. Synthetic cannabis, about the same as smoking, and that's like concentrates like shatter. So some indication that people see some relative risk, but probably not as great as it probably should be. As I said, concentrates are, I was going to say a whole other ball of wax. I don't know why that came up. Wax is obviously something people refer to as concentrates. But should those be allowed on the market? What should the maximum THC limit be? Well, the government's already said that there will be a limit for cannabis oils. There will be a limit when edibles come on the market in terms of 10 milligrams of THC per unit or serving. And we should probably figure out how to label these things properly. I do work in food labeling. We know from 30 years that people can't understand what 100 milligrams of sodium are or 8 grams of sugar are. So we probably, if I asked people here, we could embarrass ourselves by trying to figure out how many milligrams of THC and how that translates into dose. And we've done work showing that, you know what, just tell people. Some very dedicated users will know what milligrams are, but just tell them. Tell them if it's low, medium, or high. Tell them how many standard doses there are on a product. Don't require people to do math and try and figure out what it means to them. Maybe we can even find more intuitive ways of dose. This whole problem of people eating too many edibles and getting too much and having a bad experience. Most of us, when we buy a chocolate bar, we eat the entire chocolate bar. At least I certainly do. Most of us might not be aware that there's 10 doses of THC in a chocolate bar. And so there are simple things that we can do through regulation, like ensure that each dose is wrapped separately, like we do for gum, like we do for those mini chocolate bars at Halloween. These are very simple, intuitive ways of minimizing excess risk in terms of accidental or over-ingestion. And what about price and fiscal measures? Well, we're all aware that the government has to come in with a competitive price so that we minimize the illicit sales and maximize purchasing through licit means. But one of the things that we started to do in tobacco is to have price incentives so that people actually have an incentive to use the less harmful product. So we don't apply the same taxes to e-cigarettes as we do to conventional cigarettes. And guess what? It works. People are very price sensitive out there. So do we want to do that? I mean, that's an important question. Maybe this is the second stage, but if there's a consensus that some some products are less harmful than others, well, you can shape consumer behavior by building in price incentives. And just to finish off, I mean, you heard from Hannah that it's kind of a no-brainer to invest some revenue into addiction treatment services. It's a minority, a very small minority of cannabis users that will seek this and benefit from it, but that's still a reasonable number at the population level. And if we're going to legalize this, we should darn well make sure that people have services. We have not done a good job of that in tobacco, where the old metaphor is we've pulled the fire alarm, but we haven't shown them to the exit. And so at a minimum, we should ensure that people are aware of services. It doesn't have to be a clinic, it doesn't have to be a clinician. There are population-based services like helplines and things like that that can be promoted. And when we went out and asked 1,000 people, do you think it'd be a good idea to put a helpline or a phone line number? By the way, this is on every single tobacco package sold in Canada legally. There's a helpline and there's a website. And we asked people, do you think that's a good idea? And people said, yeah. We should probably do that. Even if I don't want to do that, it might help people. And guess what? There may be people that have other substance use problems that see that number on a cannabis product that then engage that service for a related problem. And I'm not going to talk about deterrence and enforcement. You could think of this another way, in which is partnerships in terms of some of the cannabis dispensaries and groups, and figuring out how to sort of partner with those groups to ensure that compliance to these different measures is maximized. One tiny thing to end on, I want to go back to what I said at the start. And I know that this is true for myself, and I'm a researcher, but we need to stop talking about use and start focusing on problematic use. We don't talk about 85% of Canadians use alcohol. We talk about the people that have a problematic use with alcohol. And you know, this is where a focus on harm reduction is important, but we need to reflect that in terms of our monitoring and our surveillance. So some generic conclusions. You can promote harm reduction through regulation, through policy measures, and that's exactly the discussion. That's where we're at with legalization, and as a community, we should figure out how to maximize that. I would suggest it's in everybody's interest, including the cannabis industry's interests. But we need to go beyond. We need to be honest. We need to be credible. We need to be specific. We need to stop talking because my time is up. But the very last point I'll say is that this is an opportunity to have a broader conversation about harm reduction when we have the opioid crisis, about engaging people with services and communicating with Canadians. And so I hope as a group we embrace that. Thank you very much.